Hey everyone, welcome back to Fried Green Avocados. I'm your host, Elisa Vitalo, and I'm joined today by my two oldest and best friends in the whole world, Sarah and Meredith. So,
Hi.
Sarah, you going to say hi?
Oh, well, I didn't realize.
Because usually
I was
when you
letting you
introduce
just know
someone,
said
you say
hi. Your
hi.
intro. Okay,
Sorry,
yeah,
sorry.
but I was like, okay. All right. Okay. Hello. And I hope by oldest you mean longest term and not
Longest term, yes.
elderly friends.
You are not my most well, actually. No, because I'm dating Tim, and Tim just turned 56. So you are not, in fact, my most elderly friends. So
Okay. There you
you're
go.
good. You're good there. So this episode is coming off of a text chain that the three of us recently had that kind of went off the rails. I don't know how we started talking about it, but we were talking about getting your tubes tied. And then we were talking about vasectomies. And then somehow we were talking about uncircumcised penises.
That was me.
Yeah, that was you. So, of course,
Or just circumcision in general, maybe, right? They're not
Yeah.
specifically uncircumcised penises, but I would like to correct the record.
Circumcised is
I'm
just
not
the topic of
sure.
conversation.
I'm not sure I was participating in this conversation.
Would you like me to
What?
refer to our messages?
As much as getting some and feeling of getting some, that's what she said. Like catching up and feeling like I had something.
all right. So I think for everybody who's listening to this gives you a preview. Gird your loins because we're going to get really into the weeds of getting your tubes tied, getting a vasectomy, and of course, Sarah's issue with uncircumcised penises.
The opposite.
So, because I do like to start things with just a little bit of background and data and, coming from a place where maybe we know a little bit more of what we're talking about than just our opinions. But for the most part, for everybody listening, we're just people with opinions. But I did do a little bit of research, and I was actually surprised that I read there are over 500,000 vasectomies performed every year, and 700,000 women get some form of sterilization every year. So whether that's getting their tubes tied, getting their tubes fully removed. And what's really interesting is that those numbers, and we'll put a pin in the politics, but those numbers have actually gone up since overturning Roe v. Wade. So there are a lot of women who are thinking about this, a lot of men who are thinking about it. And I was also looking at a study from the 2024 Kaiser Family Foundation Women's Health Study. And they reported that about a third of women between the ages of 36 to 49 have had some form of sterilization, and that's their primary form of birth control. And 16% say they're relying on their partner's vasectomy. So basically, over half of women our age are relying on some form of sterilization, whether their own or their partner's, in order to prevent pregnancy. So I figured, Meredith, you've had your tubes tied. And I feel like this whole conversation really aligns with what we were talking about in our text chain, where you were saying that a lot of the couples, either the husbands have had vasectomies or the women have had their tubes tied. So I was wondering if you could tell us a little bit about why you decided to get your tubes tied versus Brian having a vasectomy.
So I was going to have my tubes tied maybe a year or so after Michaela, because we were kind of just, in it. And I was like, who wants to bother with condoms? I don't want to use birth control. And so we were just doing the rhythm method, which worked perfectly for us until, oops, we were drinking.
Until your third kid came along.
Until we were drunk, and I woke up the next morning, I was like, I'm ovulating. I want to be pregnant. And every time we pulled the goalie, I got pregnant very easily. So we're very happy that we had a third. He completes our life. But then I was done. I didn't want any more. Yep. So I had said that I was going to have, because I'm already open, right? So you might as well just do it.
So it was during during
the C-section. And you had to say it before like 37 weeks. Because I think when you're so pregnant and uncomfortable, you're like, I'm never doing this again. So I had to put it before. And then on the operating table, they asked me, are you sure you want to do this? And I said, because I'm also medicated highly, I go, you're lucky I had this one. I did it for him. And so I was like, I'm done. So now I'm in recovery. And a social worker comes in and is like, how are you feeling about the baby? are you happy? Are you okay? I'm like, what are you talking about? It's because I said that. And they wanted to make sure like I was like going to be okay with the baby. I was like, I'm just joking. I was like,
Like you're not gonna like murder your baby, basically.
yeah, but like I get it. It was just kind of like, I guess, like humor,
Yeah.
you know? And they were like very serious about it. And I was like, oh my God, I'm so sorry. Like I was just teasing.
Yeah.
Happy to have them.
And they didn't ask whether or not you were coerced into having this child.
Well, I was here, so it didn't really
They were
matter.
just like, hey.
Well, I want to make sure that I was like happy to have the child,
Yeah.
kind of thing. But yes,
It was your first boy, right? So it was
He is our only boy.
even more. Yeah. So it's even more appropriate that you said, hey, did it for him, right? We got to go for that boy.
If it would have been a girl,
I mean, it would have been the same, I feel like.
You know, whatever. But
Sounded like
obviously
you were
we're
having
happy to
a
have a
moment.
schnitzel.
It just sounded like you were having a moment, like, you know, you were all drugged up and having a baby and you're just like,
But I was like trying to be funny.
yeah.
And they kind of laughed and they laughed, you know, and he's like, okay. He's like, you make cute babies. You sure? And I was like, you're looking at this one. And then again, thinking I'm being funny, then like a half hour later came social worker to be like, how are you feeling? And I was like, wait, we talk about lady. But
So then, but your friends, a lot of them you said have their
so
husbands.
I'll say out of 4 friends, they all had vasectomies because the recovery is like 2 days. It's so much easier. So they got vasectomies and everybody's happy because you can reverse it. You have the option to reverse it. And to me, that was like the biggest thing that I could feel like if I didn't have my 2 times in that moment. If I had a vaginal delivery,
Yeah.
I would have absolutely made Brian do it because I don't want him to have any more kids. God forbid something happens. My kids should be his only children. You should
I think
not
that's
have any more
totally fair.
kids.
Yeah.
That's how I feel because I'm going to age out and you can have kids when you're 80 or something. So no, my kids are the only ones you're going to have. Done.
I mean, in theory, he could have kids when he's 80, but I feel like those sperm, like they've got like a little walker at that point, you know, they're like trying to get there. So it's really happen.
But meaning like he doesn't have an age. He doesn't have time.
No, he doesn't have
Like,
a
we have
time limit. But the thing is, I mean, you still could have said, okay, even though I'm in for the surgery, I don't want to get my tubes tied. Brian, you go get the vasectomy instead. What was it that, did you
Because
just make,
my
like, I'm already in
recovery,
here?
right? Because the recovery, why I'm recovering for a C-section doesn't change at all from having my tubes tied.
Oh, okay. So it's
So
basically like
the recovery, I'm already going to be recovering for 12 weeks. It just adds
What's the
into it.
difference?
It's just the same. So just do it up.
Yeah, yeah. So yeah, I mean the vasectomy recovery is really easy. I was with the guy that I called the bone sucker.
Mhm.
I remember that guy. We can talk about the bone sucker story.
That's for another episode.
That's for
people.
another episode. It has to do with bone and meat, which I don't think makes the story any more clear. But he had one when we were together. And then
Yeah,
it was
that's
like a
what I
week
thought.
later and he was ready to go. He's like, my doctor said I can have sex again. Let's go. And I was like, okay. What I didn't think to ask beforehand and then asked afterwards, you are still fertile, I want to say, for the first 20 or 25 times, whatever it is, after you've had the vasectomy. So you can still, you know, get your partner pregnant. I was like,
So let me
this would
share
have
a
been good
story
information to have.
about my coworker, who had 2 kids, and the minute she was pregnant, she just like was sick the minute she got pregnant. And so now it's her girls are 10 and 12, and her husband had a vasectomy, never went for the recheck. And all of a sudden she's just vomiting nonstop. And everyone's like, you're pregnant, you're pregnant, you're pregnant. She's like, no, he got a vasectomy. No, he didn't go back to check. It didn't take. So they have a kid. They have a son. There's 2 girls. They have a son 10 years later.
I don't know how it doesn't take.
I mean,
How does
again,
that-
so with that being
he
said,
go?
she's like 70 now.
Yeah.
So I don't know if techniques have changed, but something about getting it checked. I didn't ask so many questions. She kind of told the story and I was like, oh my God. And then
That's awful.
moved on. Like, what's wrong with your husband's balls that it didn't work? You know, so I
Yeah.
just didn't ask those kind of things. I just was like, wow, it's incredible. Good mental note.
It's a good mental note to have. You need to keep moving things through the system. I think, you know, things get backlogged in there and you're just still
Yeah.
fertile is kind of my impression. in my robust medical knowledge of this.
I guess that makes sense, right? It's got to be, you got troops ready to go. They're lined up.
I guess. Yeah.
Yeah. What's the cycle on that even? What's the cycle on fresh sperm, people?
I don't know. I feel like this is
Probably
something we
the
need to
same as
Google.
like, right? I never really
I
thought
never
about
thought
it.
about it. I
I
just figured,
know that it's like, it's kind of a pretty on-demand spermatozoa, but there's some stores, right? It gets stored in the
I would think so.
testes.
I mean, it's this
Yeah.
sperm bunker down there. I don't know. It's just waiting.
Mhm.
So, but have you guys thought about this, Sarah?
Nope. Just nope.
Nope.
It's just, I mean,
You're like,
it's
nope.
never come up. It's just, it's never come up. No.
But you're thinking about going back on birth control, you said, right?
Right. So I have been off of consistent hormonal birth control for probably over 10 years. And I was taken off of it because my migraines got markedly worse.
Really?
And taking hormonal estrogen-based birth control particularly is a risk. And at the time we were like, well, maybe we want to have kids or whatever. We're not
Yeah.
great final decision makers or whatnot. And we've explored those things. And as you both know, we've had a number of miscarriages and none of them actually planned. I mean, one of them happened when we were actually exploring fertility options. And when we first went to our appointment, unbeknownst to me, I was already pregnant, but none of them have gone past, I guess, the 12-week-ish mark or something to that effect. And one of the reasons I was thinking about recently going back on hormonal birth control is more access to the mini pills, the progesterone-based birth controls, but
Mhm.
also that I had another pregnancy scare recently, and we have moved beyond that topic in our lives. And the other reason is that my menstrual cycle has never been pleasant, and for various reasons. Sometimes it was cramping, but most of the time it was inconsistent bleeding and irregularness and heavy bleeding, light bleeding versus what have you.
She
So
has
I was thinking about
endometriosis,
it
by the
again.
way.
What, Meredith?
I think she has endometriosis.
Me?
Yeah.
Yeah, suspect, but it's not something that
But they won't know till
can
they
be
open you
proven
up.
until you have surgery, right?
Yeah.
So I have asked in the past when I've struggled with some of my menses to be sterilized, and those conversations have not gone well.
So,
With physicians. So that's another piece of it, is that
Interesting.
when you want to voluntarily do something or you're presenting with symptoms that really impact your life, they
mhm.
usually avoid trying to do a sterilization unless you've already had children.
Yeah. It's really interesting because I was reading these articles. It's interesting you bring it up, especially since Roe v. Wade. There have been doctors talking about how more young women are coming in requesting sterilization.
Yeah.
And the conversations that doctors have been changing, especially in the last 10 years or so, where,
Correct.
they're more open to doing it than they used to be
Right.
in the past. But
Whereas when I was asking about it, it was more in the range of 10 to 15 years ago, right?
Yeah.
So, and then it just was like, okay, whatever. I mean, there have been real policies in the history of medical practice and policies in terms of politics and racial politics and things like that, not to go too far down that
Yeah.
road, of forced sterilization, right? So, and that is a very true thing that as a young, white presenting young woman who was in my 20s, early 30s, saying to someone, I can't live with these symptoms anymore, and I can no longer take hormonal birth control
Yeah.
consistently. I just get rid of it. I don't need it.
You want a hysterectomy?
I don't want children. Right. And that was something that was not as welcome even just a decade ago. So it was very interesting.
Yeah.
Did you want a full hysterectomy?
Mhm.
Yeah.
Yeah. At that point, my symptoms were I couldn't function at all for a number of days. So
Yeah, I mean, I remember you both used to have really bad periods. Meredith's, I don't think, have been as. I remember when we were in
Because I
high
got a
school.
hysterectomy.
Yeah.
Best thing I ever did. Kept my ovaries.
and they did that. They probably did that without question because of the time we're in, right? So that was recent, and
Oh
because
no,
you had already
that was
had
my option, and they offered to
children.
do one.
Right.
I had my doctor is very open. We talk about everything, and he tells me all my options. From I tried 3 procedures before I had the hysterectomy, and they all failed. And then I'm like, 6 months later, I'm like, we're having a hysterectomy. I'm not going to keep doing this because I had really bad endometriosis and on other organs, and I was getting rapid stabbing pains like you can't imagine, which
Yep.
I've had kind of my whole life. Plus, I grow ovarian cysts. And interestingly enough, I have a 5 centimeter cyst on my left ovary currently and a 4-1 on the other side. So he's like, you let me know what you want to do. Do you want to go in and
Like
remove
take
the
your
ovary?
ovaries?
And he doesn't push it. He said, this is your option. I can clean up your ovaries, like burn it, like pop and burn them to get the endometriosis off. He's like, this is after my hysterectomy, by the way, 3 years after. He's like, we can take out the ovary or take out one, or we can take out both ovaries. And he knows I don't want to remove both ovaries. I would remove one if I had to, if it was damaged, like really bad, but I can live with what I have compared to what I used to be in. This is like nothing. And you never realize how bad your body feels all the time until you have a hysterectomy. And I feel like everyone who's ever had it says the same exact thing. You don't realize how often you just don't feel good and it hurts and you're in pain and you're sore and you're aching. It like all went away.
That's crazy.
But I still ovulate, by the way, because I still have my ovaries.
Okay, so you still ovulate.
So,
Okay.
Right. And your hormones are still balanced because you have
You
your
still
ovaries.
ovulate.
And that's the important part with the progesterone,
Yeah.
estrogen, testosterone equation, right? So as your sex hormones are still being produced, are still balanced if you retain your ovaries. But if they take your ovaries, then you'll probably have to go on HRT, which is hormone replacement therapy. Right?
So I have a friend, she's same age as us, and we got the hysterectomy like a month apart. She got hers, but she took the ovaries as well.
Gotcha. So she went into menopause right away.
Right.
Yeah.
Right away, like just sweating at work, like buckets. And I was like, oh my God. And it was like soaking through scrubs. So she had to start taking these supplements, and it was a whole thing. But I was fighting. Again, I know it might have to happen someday, but for now I'm fighting to keep it.
It's funny because I just had, and I have kind of perimenopause and that whole thing. It's a separate subject for this down the line. But I just did an appointment I signed up for, I don't know, you guys probably haven't seen it because it's on the West Coast, but it's called TIA. They're these holistic health clinics for women. And a bunch of these are popping up now. So it's like you get your gynecologist talking to your primary care, talking to your weight loss specialist, talking to everyone. And so
What if your gynecologist is also your primary care now, right? Not the terrible actions I had before, but my gynecologist was so awesome when I was pregnant back in 2021 that I was like, you're now my primary care. And I actually sent her a thank you note. And I'm like, thank you for not judging me. Thank you for actually talking to me. Thank you for taking things I say seriously, taking the time, being really centered. Thanks for not calling my pregnancy geriatric, right? When I was like, oh, you're not concerned about she looked at my chart and she's like, you're not that old, right? But technically at that point, I was a geriatric pregnancy, right? Or I was having a geriatric pregnancy.
After 35, right? It was geriatric pregnancy.
Yeah, exactly. Yeah. So I was like, you're my pregnancy doctor. So if they're the same people, which you can do, people. You can have your gynecologist if you like them of course, be your PCP as well. So, and I think that maybe probably goes for many specialties as well, that they could probably be your PCP.
I think so. I think it just depends on the hospital system that you're in or the insurance that you
It depends
have.
on the insurance it covers
Yeah,
and
right,
But
exactly. Or if they're also like probably had some training or board
if they're
certified in that,
dual, yes.
whatever it is. Like my grandmother's pulmonologist became her primary care
but
at some
really,
point.
I mean,
So
when you
it's
find a good doctor, don't let the good doctor go. They are few and far
exactly,
between. Um,
exactly.
but yeah, no, I signed up for this
So
thing because I've
Tina,
Tia, TIA.
Tia. Mhm.
It's been pretty good so far, but I signed up because I'm like, I think I'm starting with perimenopause. And the woman was like, why do you think you're starting with perimenopause? And I said, well, I've just been feeling kind of run down. And the other night I woke up and my boyfriend was snoring and he's like so hot. He's, it's like he's on fire all the time. I said, and I seriously sat there for a full minute and thought about smothering him with a pillow because he was just snoring so loud. I'm like, and I said that to my mother, and she's like, yeah, that might be perimenopause. But her go to was, oh, well, we could start you on HRT. I'm like, it's not that I'm opposed to HRT. I know that, it's shown that you're not going to cause cancer and all of that stuff. But I don't know. Is that what I need right now? It feels like that's where you're just like making the jump to HRT. And is that where I
Yeah,
should be
if your body
starting?
needs it,
Or
then it needs it, but run a test first.
exactly. So I was like, I said, oh, okay, well, I'm going to come into the office next week and we can do a full hormone panel. I want to do all my vitamins and, the whole kit and caboodle. And she was like, well, a lot of times we don't even run the hormone panel beforehand. And I said, what do you mean you don't run the panel? And she's like, well, what if it shows that your hormones are okay, but you still feel awful? I'm like, well, then maybe I don't need hormone replacement therapy. Wouldn't that be the conclusion? She's like, but it all depends. Maybe you're at a different point in your cycle, but at another point in your cycle, you do need the replacement. I'm like, I'd still prefer having a baseline. So let's start with a baseline.
Yes.
We'll go from there. But I feel like doctors are getting way more gung ho on the hormone replacement therapy than they've been in the past. But anyway, we digress
Yeah.
from
Well, I love my OBGYN because he gives me like 6 options and he's like, he'll call me Friday at 7 p.m. and he's like, let's talk it through. And he literally said, you have surgery? He goes, just call my office and book it. And I call and I'll say, what day is your ultrasound person there? I have a cyst. And he goes, if you say you have it, I know you have it.
Yeah.
Because I actually went to him when I was pregnant with Jameson. I had a huge 7-centimeter cyst, and my current OBGYN wanted for me to go in surgery. You can't go into surgery when you're 14 weeks pregnant. That's not safe. It's not life threatening. So I actually left that practice and I interviewed 2 or 3.
Mhm.
And he came really recommended really highly. And he was like, yeah, no, we're not doing that. He goes, we're going to probably do a few more ultrasounds. We're going to watch it. But as your stomach grows bigger, it's going to push and it's going to,
It'll burst.
and that's exactly what it's going to do. And it did.
Mhm.
So,
Which I'm sure was equally painful, but
well, and not when you're pregnant because everything's painful to an
that's
extent.
fair. That's fair.
But well, I guess bursting versus draining. So, but who knows? But yes, I was
wait.
fine.
So how did you interview the OBGYNs? What were you looking for?
I don't know. Their personalities. So I've always had women.
Yeah.
And this is my first guy. But he's like 5'4", baby. And he just runs around the office. So I'm like, oh God, he's fine. I don't care. But I love him. I recommend him to everybody because he's so great.
I'm just envisioning your gynecologist as being like the road runner, like this little
That's what he is.
thing, like,
And he goes, I'll see you in the office. And I'm like, okay. And then after he examines you, you then go in his office and he's like, let's talk. Here's referral if you need it. Here's this if you need it.
okay, we talked a lot about getting your tubes tied, getting vasectomies. Why are we talking so much about circumcised penises at your dinner table? What's going on? Why?
And I did the dinner table. These are, so we all have, 3 of my neighbors all have bars in their house that the husbands have built. So
Okay.
maybe there's anywhere between 6 couples usually get together, most in the neighborhood, and everyone brings their kids and everyone we rotate houses. So this was in March. And how do we get on this topic? Oh, I don't know how we get on the topic, but they're not circumcised. But every other male in the room was. I don't know how that even got a topic. But then our neighbor
I'm gonna go with alcohol. Alcohol is how it happened.
Alcohol,
Yeah,
absolutely.
just a
But
hunch.
our neighbor, he's only circumcised because there was an issue. So now we have a huge discussion on whose kid is, whose kids didn't, what's the benefits? And now this is our conversation. And then it's like, a lot of population isn't. I'm like, oh, no, a lot of population is. And then it goes, why are only dildos circumcised?
I wonder if it
How
depends
often
on,
do you see an uncircumcised dildo?
but I wonder if it's where you're getting the dildo. So because again, I was trying to get some facts before we had this
Oh, I
conversation.
have also researched you can get them.
Oh, but again, so in the US, 80% of men are circumcised, but I don't know what that number is in other countries. So maybe in other
Right.
countries, the default is the
Correct.
uncircumcised dildo.
So now I've decided after our third drunken penis conversation that I am going to have a dildo. It's going to be like anteaters, tips included, or like we're going to have some kind of little slogan. So now I'm planning this with the 20-year-old kid, by the way. And we're
It's not
just
weird at
like,
all, Meredith.
no, but I mean, it's
Weird
not, and
at
Brian,
all.
whatever. And so he's the neighbor's kid. So he comes over and we're like, this is what we're going to do. And I'm telling him the slogans. I'm like, we're going to do it. I'm going to call them anteaters. We're going to market it.
Oh, so it's your line of dildos, the uncircumcised anteater dildos by Meredith. Got it.
Got it. L'chaim.
Meredith, I know or Sarah, you stepped away there for a minute and came back to Meredith's.
No, I heard everything.
Okay.
Yeah, so I walked back into this conversation. So I also agree that the central, the thread that's pulling all of this story together is
It's penis.
bars and houses. No, bars and houses and alcohol. It could be the alcohol is the reason.
I mean, I think we can all agree that alcohol and penises just result in trouble.
See, now the conversation goes
talking about them in regular conversations.
Week, it was like, so we're not on that topic yet as we're playing. And I say to my friend, do you know? I was like, if someone says, do you dress left or dress right? Do you know what that means? And she's like, no. I go, I didn't either. Brian had to tell me. So her husband is Brian and I'm Brian. So then now we're like, what do you dress? And then they both know what to say. So I'm saying it to her and we're all dying laughing. And then that spun into something else. And then
am I the only one who doesn't know what this means?
Yeah, I don't know what you're talking about.
Oh, okay. So when you're wearing dress pants, like a suit, the penis has to go either on the right leg or the left, or left or whatever. It's got, and I was like,
tuck left. Okay.
Right, you have to go one way. So do you dress left or do you dress right? And then the goes. Then I'm like, I've always wanted to hold it when they're peeing. And the boys thought that was so funny. Well, I don't have anything to hold. And then the two other wives were like, oh, yes. I'm like, see, it's not only me. They're like, guys, we're going to see who does it tomorrow. None of us today.
Yeah.
But
at least one of you.
And then one girl is going, why do they have to hold it? Don't they just lean forward? I'm like, oh, you really know nothing. And it's like peas all over the seat.
No, that not everybody.
Even when
holds
they hold it, it's all over the. Well, they
have to hold it. Then you doesn't have a lot of direction.
I say that to my husband all the time. I'm like, you came out of the bathroom and you didn't wash your hands. He's like, I didn't touch anything. I just touched my knuckles or whatever. And I'm like,
did you pee down your leg? Like,
no. He also doesn't wear like boxer shorts or anything. He wears boxer briefs and stuff. So that's also harder to tuck left or tuck right? So you do other things. I don't know. I don't ask questions like that. It's
in dress pants, because of the seam closest to the crotch, you got to dress one way or you're going to crush it.
It depends. It depends. If you have you have dress pants that are nice and generous in the crotch curve for you, it can leave you a lot more room and you can help tuck it in with a boxer brief.
That means your dick is small. Just saying. You got to dress left or right. How's it dead center? If you're sitting, the seam goes in.
Thank you for articulating what we were all thinking.
I have to ask Brian this question now. Maybe the balls are big. Maybe like his balls are big or something. I don't know.
Does he have like elephantitis of the balls? Is that it? Is that what's happening? Yeah. But I feel like this question, this is
but this is really
what does it say about a man if he dresses right or dresses left? I feel like this is
the wiener's preference.
But I mean, what is the wiener telling us?
So when you said that, I thought you were talking about how women and men's shirts button.
On different sides, yeah.
So one is the buttonholes are on the right, and for men, the buttonholes are on the left.
Yeah.
Interesting.
Usually, not always, but usually.
Ah, see, fun fact, learn new
It's
every
a
day.
weird tradition. I wonder if pants are the same.
Oh,
Well,
like they
women's
fly?
pants-
Wearing pants right now. My
Yeah.
button is on the opposite side of my shirt buttons.
It always points to my right hand.
Points?
Yes.
Or
yes.
like
What does that
it's
mean?
You have to
like-
clip it with your cat.
yeah, like the zipper I have to do with my right hand because it's like and then the button, like I button it toward the right. But I'm trying to think of men's pants. I've never actually noticed. I wonder if that's a thing.
Probably the same. Probably the same.
Hmm.
But it's interesting here because I've just noticed that as wearing a blouse that is made for a female is that the buttons are on the left, whereas the button is on the right. Right. And then the
So-
buttonhole's the opposite side, right? So
Yeah.
Back to dressing the wiener. So I'm like, I Googled it to see like, do
Oh, okay.
all men have to dress left or right?
Yeah.
And so it said, the question is really, which side does the crotch, the appendage naturally hang to? Right? I guess you could hang a little more one direction than the other.
I mean, that
maybe
makes
you're
sense.
hanging center and you're not crooked.
I mean,
I don't know.
I don't think that it's not, I mean, you could hang center, but it's sort of like boobs, right? Some boobs are closer together, some go a little further
Mhm.
apart. Some
But
are
they
up,
do
some
say
are
most
down.
men dress left. And they say a lot of left-handed men dress right. And this is just what,
So
AI
maybe if
says.
you dress right, it's sort of like the left-handed, right-handed. So if you dress right, you're the more creative type. If you dress left, you're more
Maybe.
logical or something.
All I know is if I see an outline in pants, I'm like, come on.
But it can't stay centered. It has to go left or right because it's going to crush it.
Okay,
So
that's
that's-
not what I'm talking about right now. I'm talking
Oh.
about if I see an outline of a pee in pants, it's like seeing it's
I look at it.
I
don't
look too.
care.
I mean, everybody.
Absolutely. On the subway, you get like the streamline. You're like, oh God, or like, where is it? How come I don't see anything?
Okay, here's a good question. How does it always show in gray sweatpants? What is it about gray sweatpants
Always.
that's the
Always.
thing? Why?
I think
I
that they're
don't
not wearing
understand.
undies. I think they don't wear undies or something.
But it's not other color sweatpants. It's always the gray sweatpants.
Because you can see it better.
Maybe
Like it's
I
hard
like the
to,
color.
and they sort of side angle. It's kind of hard to see in
know.
black or navy.
I don't know. I don't know what it
agree.
is about the
The
gray.
gray sweatpants are like right there.
Yeah.
Well, yeah. I mean, if they're black sweatpants, traditionally black sucks in all of the light, right? So, which is why black velvets and very dark colors and velvet in particular is very slimming because it just sucks in all the light. It's not bouncing off of weird folds and things like that. So I would assume black sweatpants are like dark navy sweatpants. You're not seeing as much of the
Listeners,
contour.
if you wear black or navy sweatpants, you can't see your dick. So don't do it.
Right. But I wonder what's the difference
saying.
between a gray and a white.
I just
Have
think
we
nobody
con-
wears white. I don't know that
Mhm.
anybody wears a white sweatpant.
I got Luke some white sweatpants. I haven't seen him wear them in a while, but they're not sweatshirt material. They're like the modal.
The what?
It's like it's it's a rayon material.
Oh, okay.
I feel like
I've
half
never
of what
heard of
I'm
that
saying
material.
is just about fabric and clothing construction and crotch curves in your seam. Like,
Okay, but Sarah, this is
is
why
this a podcast about sewing?
no, this is why we balance each other out because Meredith goes right to the dick. And Sarah thinks like, what about the curvature of the seam in the pants?
I'm
And
like,
I'm somewhere in the
You
middle.
solve this problem? Like, this is a problem to solve, obviously.
I just was happy that I wasn't the only female in the room. And I think it was 5 of us, maybe 6. And nobody knew. 6. Yeah, 6 months. No, nobody knew.
Oh, all right. So we're going back
never-
to the dress left.
I'm just saying. Well, even that.
I had never even heard of
Yes.
that.
I
And
feel
none
like
of
I
them had
heard
ever seen an
tuck right and
uncircumcised
left.
dildo either.
What about something? Oh, about the uncircumcised dildo?
No one had ever seen one.
I don't think I've seen one either. Come to think of it.
Put that little thought in people's minds.
You know, taking the Sarah bent on this, I wonder if it's just a production cost issue. You're gonna have a little extra
Right.
material there.
Well, and how and
But doesn't when it
okay,
get hard,
so
it comes out of its shell?
Well,
okay.
and
So
you have to make it more adjustable because then you gotta like
right,
go up
that's
and
what I was
down.
gonna say because if in my limited experience on these things, it's not a movable, pliable thing, right?
Mhm.
So it's probably a standard default to just say this is the fixed thing we have, right? Whereas a foreskin does move,
Yeah.
right? And moves more the skin of the actual shaft
And you're
moves
gonna make it with the
more.
wrinkles, will be hard to clean if that's in there. That's a good point,
Well,
Sarah.
There you go.
yeah,
It could be a sanitation kind
Sanitary.
of thing. Yeah, a sanitary thing. I mean, that's the whole reason to get circumcised to begin with. I mean, that's the main benefit is that it's more sanitary, it's easier to
right.
clean, you have a lower risk of UTIs and STIs and all of those things. Well, so I'm curious, Meredith, you were saying that your neighbor's sons aren't circumcised. So why did they decide not to do it? Since it's so common here.
Because in other countries, it's not included in the healthcare, and so they have to pay extra for it. And
Yeah.
Interesting. All right.
So
Because it's
I
pretty
mean,
standard here. Like your
yeah,
insurance is gonna pay for that.
100%.
my husband's mother said she got it done with her boys, all of her boys, all boys, that because she wanted them to feel normalized in looking like their father, which is a little weird to say, but you
Lord.
see your parents naked, right? And you're naked as young children and things like that. So part of the motivation there is sort of a generational, traditional thing. Like your father, your parents had it done, therefore
You
the
shouldn't be
children
seeing
maybe
your
had it done.
parents naked over a certain age, though.
Of
That's
course
true.
Just
not.
saying.
Of
Yeah.
course not. But I mean, the foreskin definitely is noticeable when you're a child as well.
But by the same token, you do see other guys in the shower, like,
Oh, that's true.
Right.
that kind of stuff. Curious, Meredith, do you know why it's a tradition in Judaism?
You know? But I mean, Muslims do it as well.
Interesting.
Mm.
I mean, I wonder if it is like just an old
You get stuck
sanitary
in
thing.
there, I don't know,
Is
from
it
the
like
desert. I don't know.
yeah, you get sand in there and it's a problem.
Hold on. If you cut this part off, it doesn't hurt so bad.
Yeah, there you
All
go.
right.
You don't get like the sand pebbles stuck in there and
Fan rash, like,
I
ugh.
know. That would be really interesting if you found some like old scrolls or something with the medical. It's like, yeah, there was this big sand in the penis problem. And it led to all of this. Like,
I feel like
I
I'm gonna
think that might
Google.
be it. I feel like that's probably it. It's just a sand in the penis problem. And then now it's, 4,000 years later and we're all having this conversation.
But it's literally has to be something
We are
fun
all
or
I think Meredith and her friends are having a conversation.
Okay, but
We
now
can
we've
only
been
say.
during
roped in.
cocktails,
But
though.
now we're doing it,
We've been
right? And
roped
how
into the
many of our
conversation.
listeners?
Are you actively
But
Googling
honestly,
the
once
history of
once
the
they're ready
bris?
for action,
So it
there's
says in the
no
book of Genesis, God tells Abraham to circumcise himself to show your will to God. And so it also says that it's symbolic that you're prepared to procreate, like you're ready to go.
right. I thought that as well. I was like,
See
okay,
that.
that's
Okay.
it's a you're more at the ready. There's no skin that has to be peeled
Finding it.
back in order for it. Like you don't have to peel the banana. Hey, but I will say that once it's ready to go, it's not that different.
Does it really
It's
take
definitely
longer?
not that
Like, I don't
different.
know.
No,
It's really now.
I am very naive
no,
and I really know nothing. You guys could tell
no,
me
there's a
anything and I
little
would
there's a
probably
little
believe
more
it. Like,
movement and it's, whatever.
It's
what do you
not
mean it
like
moves
a
more?
well, because you have
Kind of
foreskin. The
ahead of its
foreskin's
own.
moving. It's a bit, but it's
It's
you got more to work with. There's
Now
lots
I'm
of
gonna
yeah.
really watch like a uncircumcised porn or something. I've never even seen it. It's gonna
I don't,
happen.
I don't know.
I
I've ever seen that out there. To be honest with you,
Is it?
I don't know. Maybe again, like
Food for
This
thought.
is something else that I like do not do.
so.
I
I'm
don't
trying
do
to.
it either.
No,
I
I
don't
mean,
either, but
and
I'm
maybe
about
this
I
is
to.
can't
just
even
our
watch
lack of
like love
watch.
scenes in a movie. I'm like, look away, dogs, cover your eyes.
I'm
I'm
like
like,
very
so
curious.
necessary.
I,
Anyway,
it's I'm with you, Meredith. It's more out of the curiosity aspect. I'm watching this going,
Well,
okay,
and again, maybe I'm never
interesting.
ever going to look at it, to be honest. But it just, as you talk about it, you're like, wait, all of the dildos are a thing, all the porn in Playgirl,
I think it's
right?
But in
I
It's
think
all
fairness,
like,
it's about numbers. It's about numbers. I wonder if you look at older pornography, if you would see a higher prevalence of uncircumcised peni.
again,
I don't
I
know.
It's
could
like
Google
you
it. I'm
see
just
more of a
curious.
presence of female body and pubic hair,
I mean, I think there's just
right?
more hair in general. It was just a hairy time. I mean,
Is
the
it time
70s,
for my
80s, there's just a lot
mustache
of hair.
filter? Wait, should I put on my mustache filter?
Yeah, you want the
I got
mustache
waxed at 38 weeks pregnant, just so when my C-section happened at 39 weeks and it was painful, then I wouldn't go down there and be like, oh dear Lord, I got it all done.
Mm.
That's awful. You can't see. Your belly's too big.
I just do a little trimming. And Caroline laughs at me because she was asking me about manicuring pubic hair, and I was like, I said, some people are going to tell you to go get waxed. I'm like, that hurts. I'm like, I just used a trimmer. I said, and this is what you should get. And I sent her. I was like, in typical me fashion, I'm like, and don't go get those ones that are marketed toward women. I said, because they're going to charge you a lot of money. I said, and it's going to
Manscaper.
break all the
You go
time.
get
I'm
the
like,
guys one.
go get
Yeah.
yourself a Norelco. I'm like, it's going to be 13
Mhm.
bucks. I'm like, I've had mine forever and it works wonders. So she's like, oh my God. And I sent her a link. She's like, I can't believe you just sent me a cooch groomer. I'm like, I don't
No,
care.
it's not. It's a beard trimmer, which I guess down there. But
Whatever.
no, I bet you.
Oh, no,
Members,
I have a manscaper
remember
that
the
you can bring in the
jacket?
shower.
Yeah.
You remember the jackets, members only?
Oh,
They
yeah,
they
yeah.
they make hair maintenance stuff, which I got for both
You have
myself.
members only cooch grooming.
Correct.
Love it.
Isn't that appropriate? Members only, right?
I
got
bet.
in.
I didn't even know they were still around. I feel like
I
those
don't think it's
jackets were ages
associated
ago.
at all.
Oh,
I
okay.
just don't. I'm not sure if it's associated at all or whatever. I just saw it and I was like, oh, that's fun. So, just speaking of body hair, since we're talking about that, I came across the term and I haven't Googled it yet. Instead of Brazilian, French. Does
French?
anybody know what that is?
I
I'm on
don't.
a lot of Reddit threads, and one of them is like
Tell me all about the
personal. They were like,
French
somebody was just
grooming.
like, "Hey, I went and I got a really great deal on full body hair removal, and I got 2 sessions done full Brazilian on my area, but I'm regretting it. Like, will it grow back?" And somebody was like, "It might grow back a little patchy. 2 sessions is a little too small for it to be permanently gone.
Yeah.
It'll grow back. But if you do go in again, what you should go with is a French." And then it came up a couple more times in other comments, and I was like, "I've gotta what is this? And what do you even Google for?"
Yeah. What is a French?
What is a
Is that just
uh,
like a landing strip or something?
people separately said landing strip, but I'm not sure. Maybe it's
Small
just like a
strip or
square
triangle of
triangle.
hair in the center.
I, all right. So it's there you go. It's the triangle probably, or just a little
So the
boop.
difference is the Brazilian does everything, but
Yeah.
this French, it does not remove hair from the back innermost areas such as the labia.
Oh, okay. I
So they're
mean,
not going in.
I'm okay with
No,
that.
thank you. Yeah.
I don't understand how we are expected. Okay, so I got laser hair removal on my legs. Have you guys done this? So I
No.
did it on my armpits and I did it on my legs. My legs hurt like a son of a bitch. And I don't understand why we need to experience all of these hair removal techniques without anesthetic. It boggles me. Like you should be
Oh, they have cream.
numb. Yeah, the cream doesn't work. I tried the cream.
You want an epidural. You want an epidural
I
for it.
need somebody doing something serious to numb my
You need
legs
some like
and numb my hoo-ha
Xanax.
if I'm getting, yeah. Not even Zen. I
no,
need
not. I don't mean that, but like
I
No,
need
like an
something that's gonna
epidural, like
chill you out.
a nerve blocker that's like you cannot feel anything from your waist down, as if you were giving birth. Right.
I mean, I feel like epidural's a
But what
little
else
too
is
long.
gonna
severe.
work?
For
But
like,
What else is
yeah,
gonna work? Because
what's the
they
between?
make like topical cream for when you're doing at home, the at home stuff.
And
I forgot what it's called, like
and
IPL,
and so
impulse laser or something
Mhm.
like that. 'Cause I mean, that hurts at higher levels. I've tried it, hasn't worked super well, but yeah. And I was actually talking to my therapist about this the other day. For some reason, it came up that I have a really just sensitive skin and I cannot consistently remove my body hair in any way because I get very inflamed and very irritated and itchy and hivey and it ends up being painful, but I also develop ingrown hair. So it's sort of like the whatever. And I said something to the effect of 50% of the population does just fine in their body hair. It is not a hindrance on them. So I'm fine too that I do clean up every once in a while because that's what it is. I think it was in context of bathing suits, right? So I'm always trying to find some sort of bathing suit solution that is going to allow me less trimming that needs to happen in that particular area.
so I would say I've done my armpits and my legs,
Mhm.
100% worth it. Like,
Yeah.
even if because you just don't have to think about it. Then you're like,
Right.
"I'm not concerned. Oh, I've gotta do
I'm
this,
sick
I've
of
gotta do
having
this."
to think about it,
Yeah, we
right?
don't have to think about it, and it never so on my armpits, I'll still get, like, kind of some wispy hairs every now and again,
Okay.
that you have to shave, and on my legs too, I'll get some random wispy hairs, and then it's funny because I don't realize that I have them, and then I'll look down one day and there's a little patch of just very long hair, and I'm like, "Oh, crap, I didn't even" because you can't feel it because the hair gets so thin
So thin,
that
right?
you don't it's not like like you feel stubble or anything, it's just really thin hair.
Right, and if it's
It's
really
so
thin
worth
hair,
it.
even if it starts kinda growing out, if you end up shaving it, it's less likely to become an ingrown hair
Yeah.
and be painful in that way than anything else. I also just think it's, like, sort of the pulling against my skin type of thing, but that's good, yeah.
So, I do think it's time for us to wrap up. We have obviously talked about a lot more topics than just vasectomies and tube tying and penises, but hopefully, everybody got something out of this, and we will talk to you next time.